Very few people know that the immigration health surcharge or IHS that you paid in the very starting of your visa application process is refundable. Hello everyone, welcome back to my channel. My name is Gunjan Taryal, and when you apply for any kind of visa in UK, you have two major expenditures. First is visa application fees, and I don't think anyone is exempted. You'll have to pay it if you apply for any kind of visa. It can be student, it can be dependent visa, no matter what visa is it, because this is the fees that you pay to government, to VFS, for processing your file, for documentation and everything. And second important expenditure is immigration health surcharge, or you can say IHS. This is basically a kind of health insurance, or you can say it's a payment against the national health service here in UK. On the basis of the payment that you have made, you can get your national health services here free of cost. Any kind of treatment you want, you can take appointments. Obviously it's not that easy to get the appointments, but when you get it, you'll be able to get every treatment, even the medicines, free of cost. And I have actually made a video over this also, that how healthcare system, how this works in UK, what are the things which are not included in healthcare and what are not included in NHS. So do check out that video also, because if you're planning to come to UK or already in UK, that video is going to be super beneficial, super helpful. But in this video we're gonna talk about IHS refund, and yes, it is possible, but in a special circumstance, and not only for you, also for your dependents. So be ready to make the notes or save the video. That's an easy way. Now let's talk about eligibility. So first and foremost, eligibility is that for being eligible to get the IHS refund, you should have worked or should have been working in any kind of healthcare setting. It can be a hospital, it can be a GP place, it can be NHS, it can be anywhere, but you should have worked in any kind of healthcare setting. If whether you have worked as a support worker, senior support worker, or GP, doctor, nurse, or speech and communication therapist, there are many posts that are already written on the website. I'll show you everything here. So this is the first criteria, because this is the benefit that government is providing to the people who are associated with any kind of healthcare sector. And second criteria is that you should have worked for at least 6 months, so that you can get the payment of 6 months. You can apply for 6 months, and these 6 months should be at a stretch. It cannot be like divided, it cannot be like broken. So even if you have taken any paid maternity leave or paid any kind of leave, annual leave, that is also included, but it must be 6 months. Third is that you must have worked for minimum 16 hours weekly. So these three things you need to prove to them, that you're working in any healthcare, you have worked for more than 6 months, and you have worked for at least 16 hours weekly, 16. Okay, so these are the eligibility. And for that, it is not important that your partner should also be working in any healthcare setting. They can work in any setting, but one person or the primary person must have worked or must be working in any kind of healthcare setting. So yeah, this is the deal. Now let's talk about the requirements that you need to provide them. The first thing is the pay slip, because obviously you need to prove the eligibility, that you are eligible. First 6 months slip you can provide, that I have worked for this long, see, these are the slips. So pay slip, that the salary slip that you have got, you need to provide that. And in that you can also provide offer letter or employment contract, because it must be mentioned there that you're working for at least 20 hours, 30 hours, or whatever hours you're working. It must be mentioned in your offer letter or a contract of employment, so it will be proved from there. And then you can also provide a cover letter. In cover letter you can specify that how you have been working, and if there is something that you think you need to tell them, you can write in cover letter. That would be easy to make them explain. You can say, I work for this much of time, and after that I get my salary payment on that day. So they can get everything. Every kind of detail can go in cover letter, so make it like really specific. And it need not to be in very good English. It's not something that you need to show your English to them. Just write down the important details. So that's the cover letter. This is the first thing, that you're proving the eligibility. Second thing is the NI number, national insurance number. Obviously when you come to UK, the first thing that you get is BRP card, and after getting a BRP card you apply for national insurance number. For any job, anywhere you apply, they ask for national insurance number. It must be in your pay slip also, so that NI number you need to have. Third thing is IHS reference number. When you paid for IHS, immigration health surcharge, when you were not here, and whenever, even if you were here and you paid that immigration health surcharge, you must have got some sort of mail in your mail ID, and it must be given that your IHS reference number is this. So that reference number you need to mention there, because obviously on the basis of the reference number that you provide, they will be able to check your file. Next is email address, and I would recommend give the same email address that you gave for IHS. So that is like recommended, but if you have forgotten the password or unable to recover it, that's fine. I don't think it is important, because that's just a mode of communication. So I guess that's fine. More important thing is your IHS number. Next, you need to tell about your organization name. Obviously you cannot miss that. You need to tell which kind of organization you're working in, and then you must have the card through which you made the payment. They will not ask you that put the details of that card or put the account number, nothing. They will not ask for account number, not card details, nothing. But from wherever you made the payment, for whichever detail you made the payment, the refund or the reimbursement is going to go back in the same card. So if you don't have that, or you got it from someone else, I would recommend you talking to them and make sure that they know that some payment is going to come back. So it's like one of the another point, and I don't know why they have not given any account number or something, but it comes in your card. So these were the eligibility and the things that are required, and now let me show you the whole process on my screen, and you can see everything how it is done, like from starting to end. For IHS refund, we need to come on this website. I will provide the link of this website in description. Do check it out, and it's really important that you read everything yourself for the better understanding. And see, whatever I have told you so far, it's all here. Like, you should have worked for at least 6 months and at least 16 hours a week. This is the minimum criteria, and what you will get, how much you will get, and then about your dependents, you can also include them. Whatever documents you need, everything is here. You can just click on start now and your process starts. They ask for the basic eligibility here. So let's click on start now and fill the questionnaire. And here they're asking whether we have paid the IHS. Yes. And then what kind of visa are you on? If you're on student or dependent visa, click on other visa, because that's not tier 2 or tier 5 visa, and then continue. After that, did you have a job in health and social care? Yes. And then did you work for like 6 months? Did you work for 16 hours? So they will ask for this. You'll have to just click yes, because if you put no somewhere, it will not be eligible. Obviously they're asking for the basic eligibility. If you don't qualify here, you cannot proceed further for the refund. And then continue. They will ask for your name, IHS number, and then email address that you put earlier. And although phone number is optional here, it is recommended to put it here for the smooth communication. If you want to add any dependent, you can put their details, their name, last name, date of birth, their IHS number, everything you can just put here, and then continue. If you want to add more dependents, there is also an option to add more dependents. Just insert their details and you'll be able to go through. After that, whatever the starting date of 6 months period, put it here. And for example, I'm writing it here 4th of January 2023 is just an example, not a genuine one. And then you can continue. After that, after 6 months, do you want to get reminded by email? Yes. And then continue. Provide your employer's detail, provide job title, and whatever setting of work you have been working in that you need to provide. Like here, they're asking for whether you worked in hospital, GB practice, care home, community healthcare setting. So whatever setting you worked in, you just put it there. And then they have already said that 4th of January to 3rd of July, you need to provide the proof by pay slip, by offer letter, by cover letter, whatever you can. So this is everything. After this, you will redirect on the last page. Just click click on accept and send. I cannot do that because this is not a genuine file. When you click on accept and send, you will get a reference number that you will also get on your email address, and after that you will receive the payment within 6 weeks. So you saw, this was a very simple process. You don't have to do anything, just prove that you're eligible and you will be able to get your refund, and this refund you get within 6 weeks. It is set within 6 weeks, but I think you get little sooner also, so just be patient about that. You just need to prove your eligibility and that's it, you're sorted. And I hope you loved my video. This was just like really helpful one, and there are very few people who know about this process, and if you want to keep knowing about these these things, so just stay connected with my channel and see you in the next video.